Can you see that?
Success. Yep, we see the screen.
Excellent. Let's go to the big screen here. Right.
Although we're seeing your note slide, so you might need to switch the display settings.
Oh, interesting. I've never had to do that.
That happens to me all the time, Doug.
Yeah, me too.
There you go.
Swap them, I think.
Yeah.
That. Is that right?
There you
There
go.
Okay. Yeah, I don't have.
Success.
There aren't really notes anyway, but this gives you a bigger screen. Okay.
Thanks,
So,
Doug.
without further ado, the main ingredients are fish sauce. No, kidding. So social prescribing. So this is I think a very interesting topic. It is getting a lot more traction in the United States only in the recent couple of years, but including at the Cleveland Clinic and some other locations. So as a result of that, this seems to be a very perfect topic for things we can do, even as a prescriber myself, that doesn't involve medication, right? There's a lot of things we have kind of lost over the years. I was at a talk last evening about occupational therapy, and OT has long roots way back to the 1800s. Actually, one of the founders was from where I trained at Shepherd Pratt back in North Baltimore, so in Maryland. And so it was interesting for me to hear this history again from one of our partner agencies in the community that works with OT for some of the clients, patients, consumers, whatever you prefer. I tend to say patient. So anyway, so Dan Morse is the leader for social prescribing in the United States. I want to give him some credit here. Some of the slides I pulled. And then the person at Cleveland Clinic who's been leading this effort is Dr. Irina Todorov. And so just so they have some credit here on that. I've got no disclaimers today for anything about this otherwise. So here's the simple version. So you've got somebody, and this really is any healthcare professional. This is getting used in all specialties at this point, and in other countries it is used very, very readily. England in particular, United Kingdom more broadly is using this more, and it's something that we probably should be integrating into our system as part of integrated care. So you're going to make this initial referral, and then there's a link worker. And the link worker, in my mind, it's something along the lines of a peer support specialist, not necessarily a person with lived experience in this case, but it could easily be. And they will then get a sense of what is, I'm going to say Mr. Jones. I always say Mr. Jones as an example, so it could be Mrs. Johnson, whoever he, she, or they are as the patient. So the link worker talks to the individual, finds out what are their likes, dislikes, what would they want to accomplish, and then they link the person. Obviously, that means they have to have the referral sources, and they link the person to activities, not to medication, not to our sort of traditional pathways here. Now, I think I can share. I need to share my sound. Make sure I do that right. Here. Here we go, share sound. So I will show you real quick. I think the video should play here. Here we go. Let's see if this works.
There's nothing more powerful than you.
Uh-oh. I think I screwed that up. Hang on. That's so far that's an ad anyway, so let me fix that. All right, let me share this again. Could you hear the sound? Was the sound actually working?
Yep, could hear it.
Okay, so I got to figure out why it's not on the right screen now. Let's see. Sharing sound. Try this.
Terms.
We'll let it get past the ad.
Giving it your all.
All right, let's skip that. I apologize. I don't know why I've got it on the wrong screen here. Second. Oh well. Well, I'll show the video at the end if the thing allows me to. I would just do that. So let's get out of that. Okay. So why social prescribing? So about 60% of patients actually, and they've done studies on this in the United States and abroad, actually consult their physician. They target physician. They really mean their team For really social stress-related problems, and all of you, many of you in mental health arenas, behavioral health, you know that, right? It isn't that the person's necessarily coming in for I'm having a manic episode today. It's more other things in their life, and we tend to still try to go down a path toward what pill can we give you, or nowadays even what shot could we give you, or can we send you off for Spravato or RTMS or some other treatments. And logically, though, it would be nice to address a lot of these other areas. Loneliness, of course, is an area that our Surgeon General has written a big report about. I think now they equate loneliness to smoking 15 cigarettes a day. So that's pretty powerful when you look at that. I think it's an analogy that that Dr. Murthy used. Of course, it's a team who writes that report, but Dr. Murthy used that analogy, and that's what the studies show. That's how devastating it is to your health if you are truly lonely. And so that gets us into the social determinants of health, which is a huge topic area, the topic of many other discussions, obviously. And interestingly, because I'm not that old, or I don't feel that old, it was not a discussion at all when I was in residency or early career. Nobody talked about the social determinants of health. So we're finally moving from talking about it to what can we do about it inexpensively in real time, and social prescribing is part of that. So we do have patient navigators. There's people called health coaches. You all know well about community health workers through NeoMed, and those individuals get trained, or at least can be trained, to work on the whole concept of dealing with social prescribing and therefore affecting in a positive way those social determinants of health. Unite Us, I'm just picking one out of the groups here. Unite Us is the platform that Ohio seems to be using more and more than these other three that are listed there. I know that Summit County has selected Unite Us through our county executive, and we're currently working on that. In fact, in my next hour, we've got people talking about Unite Us with some of our agencies and our ADM board here in Summit County. The Ohio Health Information Partnership, which is, as CliniSync, across the electronic records, has chosen Unite Us to be that platform to work on social determinants of health and so forth. So that's probably the platform you're going to hear the most about in terms of what might tie into certainly social determinants of health and hopefully social prescribing as this moves forward. So still unique, still not being used a lot, but it's growing, and Unite Us is growing as well. And once people get to that, we'll be able to do more of this social prescribing. So you've got the person, they come in, they're lonely, or maybe they've got some moderate anxiety, moderate depression. They might even be already getting an antidepressant or an anti-anxiety medication for that, but they're not quite themselves. They're not back to whatever baseline they were hoping to achieve, or new baseline if they've had a depression or anxiety for a long time and you're trying to help them get past that to move on and have more productive life, higher quality of life. So you can show them a one-pager, and this is an example. You can see the one example here of what is this. So what is the social prescribing, and what are the types of things that maybe the person hasn't thought about, or at least if they have, they didn't think about it in a way that it's healthy. That, hey, this might actually help you more than increasing your Zoloft if that's your antidepressant or what have you. And then, of course, by talking to them about what do they like, what matters to you, then you can get into what's the prescription, which again means, well, I'm going to use some examples here from the Cleveland area, because again, Cleveland Clinic's been involved in this the most in Northeast Ohio that I'm aware of. And so you figure that out, and then you move them on to the subcategory, and then you can get some coaching to make sure that they get where they're going. Is it going to be hard for you to get there? You said you want to go to the botanical garden. You'd like to get some of that nature exposure. Is that hard to get to? If that's hard to get to, have you considered a metro park? We've got a great metro park system here. How about that? And how do you get there? How do you connect the person? And that system is getting more and more connected, as you may not know, I'll mention that, getting more and more connected as well to our healthcare system. So for example, in Summit County, we had a CIT, a one-day crisis intervention team training for the metro parks at one of the metro parks, and we brought in, they had their naturalists there. It was officers, but it was also the naturalists who give tours to the public, the very people that might get a prescription, a social prescription, to come there. And so they're already part of this, tying them into this concept of we really are a team. And now we're adding these social determinants of health to that team as broadly as possible. So here's a blow up of that one slide of what are the opportunities. Obviously, if people want to be more active and if they're lonely, then doing something like a volunteer activity or a group of some sort makes a lot of sense. If it's more of an anxiety or depression, you may be talking about individual art and craft activities that you could do. And there's even more data on that now that I'm hearing about how valuable that can be for individuals' mental health. And then nature exposure is huge. You rarely see anything about nature that does not include that it improves people's health, both mental and physical health, which are, of course, really one and the same. Healthcare is healthcare, but we tend to separate them out still in our discussions. Exercise, of course, also gets tied heavily to better outcomes for mental health as well as physical health. And again, we are one body, so that's not surprising. So getting exercise in nature is probably an ideal type of social prescription if the person might enjoy that and is willing to try it. Here's a broader sort of definition of this, and you can see here, some of you may have seen this, the Dahlgren-Whitehead model of the social determinants of health, but it gives you a sense of all the pieces that go into this. And, you know, social determinants of health, when it gets down to it, you hear about living in one zip code can alter your life. And in Cleveland, there are 2 zip codes across a bridge. On one side of the bridge, you live 20 years longer on average by being that short distance across the bridge. That's a huge statement. That is not genetics, right? I mean, you think about all the things we play on, like giving medications. A lot of that's probably more about genetics and chemistry and so forth. Some of these other conditions make a world of difference in how your general health is going to be and even your length of life and quality of life. So very, very, very important. So this is a look at this in the summary guide. This, as you can see here again, England. They have a national health system, as you know. So the National Health Service in England has a whole model for this, and they actually have what they call link workers. That's their official title over there, and they're able to do this whole arena to help people with social prescribing and really social determinants of health to help them. And in fact, of course, some of this helps the community then because you've got citizens working together. You've got citizens doing activities that might be cleaning up a certain area or, you know, building a fence for somebody that needed the fence, and that's helping that person. It helps the community, helps the people that are socializing, helps the people that are getting active. A lot of things that we traditionally have not thought about as something that we do in mental health or behavioral health. So you really are, it's really looked at protection, right? The link worker is trying to help the person, protect them, protect the provider, and even protect the referrer. You're getting a real huge, they call that the triple lock, and that really is what pulls us together. My word for that, because I'm big on it because of all my CIT work, is team, right? You're really, the link workers helping have a team here where the patient is part of the team, but also a leader of the team alongside the referrer and the other individuals. So very, very important. Language is key. As you know, in Akron, we happen to have a lot of languages. And in fact, we have to use with some frequency across our agencies. Effectif is the one we've selected. There are others out there, which is a platform for communication right there on your phone or on your computer of a live translator, so that they're not physically present, but they're virtually present with you. And we've even used that out here in our hallway on one occasion not too many months ago when somebody showed up who did not speak English. And it worked very, very well to accomplish this. So you need the language piece. And so they're given the ability to do this in the cultural context. They're given the ability to do this with a translator if needed. And of course, really, it's also about empowerment type language, right? How do you talk to the person as you can do this? And those of you, Dr. Kreider, Dr. Civic, are experts on this. So motivational interviewing, it's in that vein. It's how do you help the person see this as a positive things they can accomplish, and then of course we all do better when we have hope, and then get some help to further that hope and actually have a good outcome. You've got some kind of technology for referral, so you're not expected to have all the ideas in your head of where the person can go, although over time you probably would. A lot of social workers are experts already at how to manipulate and find the right to manipulate in a positive way, manipulate the environment and say, here's where you need to go, here's where you can get some help, whether it's social, physical, financial, and so forth. And then the questions. And again, you see motivational interviewing even listed here, helping the person to ultimately connect with people. Again, that idea of isolation and loneliness comes up. How do we work past that for the individuals? And this can be any range of types of support. You'll notice that none of them on there are medication. That's really not part of this model. That's really a piece of the whole puzzle, but it's not the model. This is about social determinants of health, which again, the Unite Us platform is ultimately hoping to help us with that. So if I have Mr. Jones, and I may be great at doing the medication discussion, but if I'm in private practice or I'm in a team, but the social worker's out that day or other experts on these things, I can go on this platform and actually refer the person to any of these types of activities or financial support, housing support, and they can get moving on that process automatically. That's great. So this one is coming from the World Health Organization. So again, this is worldwide, just not as much in the United States yet, and that's now growing. And maybe after today, for all of you, it will grow as well. Hoping that it will, using that analogy, we'll plant a seed today, and more of you will think about this as part of good care. A lot of this is focused on primary healthcare providers, but again, that's because it's coming from England, and that model as a national healthcare system really starts with the primary care provider and then expands to everybody else, including psychiatry, psychology, social work, etc. So don't take that as a negative. That's just, these slides are, again, because it's coming from England. Then they have that link worker that I've already mentioned. I'm not going to overdo that. And then they get the prescription, again, not for medication. Doesn't mean they're not getting medications from another member of the team, but that is not the purpose of the social prescribing. Healthcare facilities can be obviously part of this. I'm going to give you an example of Cleveland Clinic in a minute. This is an example for an older adult, well, I guess that's the phrase we're using now. So older adults, I'm getting closer to that myself as the day goes on. So health facilities, that team, right? And this is back and forth, right? This doesn't have to be linear. You're working with the person where they're at, very person-centered, although I haven't seen them use that phrase, but very person-centered, which we do think about a lot in our United States healthcare system. And then that social care component that helps them. And some of that's education. Remember, there are people, especially older adults, we didn't talk about these things as they were going through their lives. So now they need to learn. What is this healthy lifestyle thing I keep hearing about? Right? That they may or may not have already lived one, but they're now an older adult, and they're still probably dealing with health issues that may have started when they were younger. And we tend to forget that. They don't just go away. And they also, they can develop new ones as an older adult, but a lot of things are lifelong, physical illnesses as well as mental illnesses, substance use disorders, and the like. So we're going to help educate them around things they might not have really talked about or thought about in the past. I think loneliness, people have talked about loneliness for a long time, but really until the recent years, it hasn't gotten the focus. And then, of course, the Surgeon General's report makes that particularly important and shows a lot of gravity on, again, how dangerous that is to our health and ultimately our longevity. So again, here's that same graphic that I showed you before. Here's the Cleveland Clinic. So one of the connections they have now made is with the Holden Arboretum and the Botanical Gardens. I mentioned Botanical Gardens before. And so they even have a system set up. So the Botanical Gardens works with the Cleveland Clinic around this whole receiver of social prescribing. They work with them to be able to track who shows up. And that's actually now part of the Unite Us idea. So if I were to refer somebody to Dr. Hump, I would at least get to see if they showed up through this platform. I'm not going to read their record that way. I'm not going to get into their business. But so maybe I'm at the food bank and I refer them to Dr. Hump because she specializes in an area that the patient agrees would be helpful. They show up at Dr. Hump. I at least can look and see if they showed up, right? So that efficacy of referral, I think, is the fancy phrase, but I get to know because otherwise I might not know. Or they might tell me they showed up, maybe they didn't, right? Or they tell me, nah, I didn't bother with that, and I find out from Dr. Hop, oh yeah, they're here. But really, it's a platform. I don't find out from her directly, but that's kind of how that would work. So here's an example of the Cleveland Clinic, just one screen. There's a lot of others that they have been using already to refer people to, like the Holden Arboretum. You know, what types of things, so that's here. What type of metro parks I mentioned. Of course, we've got Cleveland Metro Parks, we've got Summit County Metro Parks that are all over the state. Compared to what I was used to in Maryland where I grew up, much better system here. I mean, that really is a treasure for us here, and obviously ripe for the social prescribing concepts. And again, a reason for us to engage the people who work in those metro parks, like the naturalists and sometimes the park rangers and so forth. So, but you can see the range they've already been cultivating and if you will, lost it there, as curating, you know, kind of opportunities to be able to use. And these links are actually live, so you'll have the slide set. I already uploaded that, so you'll have that. So again, here's a blow up of that other slide I showed you using this example from Cleveland. That is, what are these things? You've got a little bit of research here as well that you'll be able to look at after the fact, as well as the video that I haven't shown. And for time's sake, I won't, since I think we have a case today. So, and then here's another example of Park RX. Well, this is another movement, and this is obviously the United States, trying to push this concept in a more broad way, even at the national level. And you'll notice, you know, they're talking about obesity here. And of course, this slide actually predates Ozempic and the other GLP-1 agonists, one of which went generic yesterday. So that may change the framework of how we are able to access these for individuals who may benefit for diabetes or obesity. That was the liraglutide that went generic yesterday. So you'll see that coming out, hopefully dropping prices, because that's been a big burden on the systems. But you'll see here how the idea of the chronic illness, how many people suffer from these diseases as a result. Obviously, most people die from cancer or coronary artery disease. So there's obesity right in there with that as a leading cause of death. And then you get into, well, here's all the things they could be doing through this park process, right? Some of that's very direct exercise. Some of that is more introverted, but things that are very valuable to the person. Some of that is yoga, which is kind of in the middle, a little bit of meditation as well as some physical work there, just in simplifying it a lot. But so very, very good. There's a website for local social prescriptions by zip code, right? So somebody actually put in a zip code in here. Oops, not on the slide, I guess, but on the screen capture. But you can put it in there, and it'll show you that's growing. That database is obviously growing of places you can get this. So again, in conclusion, it's helping heal people. It actually therefore helps heal society, because a lot of these are group social events. And then therefore it heals the culture, because people of all cultures can choose the things they like, come together, and then that's good for society as well. So we can get past a lot of these ridiculous ideas we humans tend to have. There are differences here, differences there. Humans are humans, and for the most part, we're very much aligned. And the subtle differences are what really make life interesting, shouldn't be what are causing us to have angst amongst ourselves. And here's just a simple slide, which I'll end with, on the benefits of social prescribing. You've got more slides in the slide set that have evidence base for you if you want to look at those. But for time's sake, I will stop here for questions.